Now, the latest statistics from the Nigeria Center for Disease Control, that's the NCDC, shows that the country recorded 505 new cases as of Tuesday, taking the total number of reported COVID-19 cases to 175,264. Lagos recorded the highest number of new cases with 273 new infections, followed by Rivers with 83 new cases, while Oyo State reported 45 new cases. So far, 165,122 people have been discharged, while 2,163 people have died from COVID-19 complications. Now, the number of new COVID-19 infections has seen a steady increase since the discovery of the Delta variant in the country, resulting in the third wave. It is now more crucial that Nigerians return to abiding to all COVID-19 safety protocol to enable the country beat the virus. Joining me in the studio is Dr. Azizat Yishao, Senior Health Advisor, Lagos Health Summit, and founder, SafeBody.com. Good morning.
Good morning.
Thank you for joining us on TVC Breakfast.
Thank you for having me.
Now, like we reported, we have seen a steady increase in the number of cases in recent days, just as we discovered the Delta variant, and that is generating a lot of concerns. In fact, if you look at the papers this morning, there is a report of cases in the NYSC camps. The number of infections have risen. We have recorded a number of deaths, I think 3 so far, and I wonder what is most concerning for you with this recent developments that we are seeing.
Yes, okay, so for me particularly, for any infectious disease, I think one of the most important things is making sure that the community have adequate information so that we could, when we talk about safety measures, you understand, we have the community playing a crucial role in ensuring that we are able to combat this disease. So now that we know that there's a Delta variant, we've known that for a while, I think from South Africa, from India as well, and now that we are seeing increased cases, that the positive cases is also due to the Delta variant, not just the other variants of the COVID virus. So making sure that this information is available to the public, and then there are ways in which we could easily monitor, ensure that public spaces are keeping on to the non-pharmaceutical COVID-19. We're ensuring that also making tests easily available to people. And also, I think for me, mostly is ensuring that we could also get the vaccine to Nigeria as much as possible so that we could vaccinate a good number of the population.
Now, but would you say that, because talking about information, I'm wondering from your, assessment, would you say that we have done enough with regards to ensuring that communities understand what is going on, not just those of us who are at this level, but every level of community? How informed do you think they are at this point with regards to this development?
Yes, so I think that we've not done enough, you understand, particularly to the vulnerable communities that we know that they might find it really hard to keep up to the COVID-19 protocols. And that is why it's always important that the ministries, the health sectors, strengthening the public health centers, which are closest to the community. So there is a lot of work that ought to be done, whereby we are community social workers. They need to step out there. Some people, the people that we want to reach out may not have access to sophisticated media platforms, or even have electricity to listen to some of this news at the appropriate time. So this is the time to strengthen, in terms of education, awareness, is strengthening public health centers, which are already closest to the communities, whether it's town hall meetings, whether it's whatever system that they might adopt to ensure that they can get this information down to the people as well. And then there are other ways to incentivize or to create a culture of awareness, whereby people can also educate the members of their community and get everybody together to have a benefit from understanding what COVID-19 is doing to us as a country as well.
You mentioned something earlier talking about vaccination. We are yet to attain the required percentage with regards to herd immunity.
Yes.
And then we see that the U.S. has just, stemming from the information we got from the federal government, that the U.S. has donated about 4 million vaccines to Nigeria, talking about the Moderna vaccines. Do you think, how much of a difference or a game changer would that be, looking at what is going on, how this virus is mutating, the virulence and all of it, how much of a difference will this donation make?
Okay, so I wouldn't want to be pessimistic because it's better than none. So I think that what is most important is that there's a strategic process to administering this vaccine. So aside the government and the health sector in collecting information must be able to get particular data about the category, features, or kind of people that are coming in with, that are being infected, so that they can target those group of people, or they can target those vulnerable people. So it's not a situation whereby even if some people are lazy about it, you understand, this is not the time to say, okay, well, it's not like diabetes or hypertension that, okay, well, you could have it and then be by yourself. But we know what one person could infect 100% in a few days as well. And because we also know we have the Delta variant, which is more virulent, which is more infectious, which would, put more people at risk, especially those who have not been vaccinated at all. So the statistics needs to be very predictive. The data collection needs to be bigger, and more so that when these vaccines, these limited vaccines that we have, when we disseminate it, we target certain populations, we target certain groups of people that we know that, okay, these are the people that are coming into our isolation centers. These are the people that are coming in with this number of cases. So with the little that we have, we need to have a target and specific approach.
Talking about targets and those coming in, government has recently been talking about ensuring that those who violate the protocols put in place face the full wrath of the law. This is not the first time we're hearing that, but we keep hearing that. And I'm wondering, how effective do you think these measures to check and ensure that people, adhere to the processes put in place by government, how effective has this been from your point of view?
I think that from my own point of view, I wouldn't say that much, and I would not, because I think that the policies that have been put in place are not good on paper. It's about implementing and following up those policies. And I would say that the government and the Lagos State government have been trying to put in more effort, but we just need to ensure that we are firm on the policies that we have put in place to ensure, because this is not a personal thing, but a countrywide thing. So these policies that have been put in place, people that are traveling out of the countries, people that are in certain places that need to have take their vaccines or need to be tested, you understand me, this should be ensured. And then the government also has a responsibility to make sure that these services are readily available. Can I request for a test other than the NCDC platform? Can we have other platforms that can be certified by the health sector to mop up whatever excesses or whatever backlog that the government has? And then the government also, the necessary sector must also ensure that these other platforms that they have empowered to mop up are also doing what they are expected to do. So there's a lot of accountability process that needs to go on before we start trying to clamp down on people who are violating these rules that we've laid down.
Now, we are faced with a doctor strike at a time such as this, where we're also going through a very tough period with regards to this. I'm wondering what your thoughts are with regards to this development, because the doctors have their concerns, which we will not say is not legitimate. But then again, there is also this before us. What do we do?
Thank you very much. I think that as a country, we must always understand that we have, in most of our sectors, we have a shaky foundation. And in as much as, we have a pandemic, we must also know that doctors are also on the receiving end of whatever, excesses that may come up. At the beginning of the pandemic, we lost a lot of our colleagues, to the COVID-19 because we had issues even with, PPEs, that is, the personal protective equipment. So it might be a strategy to ensure that the government is able to quickly affirm to some of the agreement that they've had or worked on some of the agreement that they have. But as what I assure people at the end of the day is that as medical professionals, we have standard. So emergencies will still go on. It's not like as if the hospitals would be free of doctors but we are using this opportunity. It's also an opportunity for doctors to say, these are the things that we've been trying to tell you. You understand? We have another wave. Do we still also have to face these problems or these challenges as well? This will not enable doctors to be able to function very well, and carry out their responsibilities as, frontline workers in this particular situation. So I just think that when the involved parties sit on the table and the government is sincere, definitely doctors will go back to work.
When you say government is sincere, how do you mean?
I mean that, you know, in terms of when government make promises, you would expect that they fulfill it to a certain amount and they show the interest in continuously. Yes, thank you. The word is commitment, to continuously, you know, keep up with it. I don't know if I could mention, I'm actually serving right now, and we have issues. And we've been having issues right from the internship days about what is even the futures of doctors, young doctors coming into Nigeria. What is the perspective for us in this country? What is the plan? How does the state, how does the country recognize us, and what does it place us? So these are the challenges that will come up. So a lot of young people want to see that government is committed to ensuring that the profession is safe. You understand me? The integrity and the futures of those in that profession is actually safe. And so that is just what it entails. So government needs to show, they need to fulfill immediate promises, and then they need to show commitment to ensuring that they fulfill other promises as well. Nobody expects them to complete all the promises all at a go, but we need to see consistency in their promises as well.
Absolutely. Now, let's come back to the issue of still talking COVID-19 now. At what point can we say, because a lot of persons are saying they are tired, we need to get out of this, they just want to get this COVID over and done with. At what point can we say we are out of the woods?
Okay, so I think that first of all, it's normal. We call it pandemic fatigue. You understand? Even as a person, if you are managing a condition that is continuous, you understand, you get fatigue along the way because it's not natural. You understand? To have people wear face masks, to be, you know, physically distancing, you know, a lot of rules is not, part of human nature as it were. So based on statistics, first of all, we want to have a good amount of immunity. So if we can statistically and confidently say that we've immunized certain number of people, then that'll be fine. Two, we want to see the number of cases, you know, come down. You understand me? Drop down, and ensure that it continuously drop down. You understand what I'm saying? And we don't have the word pandemic means that, you know, it's everywhere, is increasing in large amounts. You understand me? So take for example, we say in Nigeria we are free of polio. We could say, oh, Ebola. You know, not like I said, we've not seen, they're not new cases of Ebola, but we are at a point whereby we can confidently say that the number do not exceed past this. We're able to pick them up in time. So for COVID as well, as a country, we could set a target for ourselves that this is the number of cases that at most we want to be seeing, and then want to continuously make effort to bring them down. And the only way we could most surely do that is to vaccinate a number of people. You understand? So we are, even if the virus is there, we are immune to it, or people don't present with extreme cases. We don't have to now be panicking each time we have, you know, those numbers as well. So that would serve as, you know, target, you know, for the country. We immunize certain number of people. We target this set to reduce the number to this setting, and then continuously improve our healthcare system. I think that one of the other things that we can do that can help is that now that we know that COVID might be here for longer than we want it to be, then our planning, state development, country development should come from the lens of COVID-19. You understand? So if we are talking about security, look at it from the lens of COVID-19. If we are talking about economic development, look at it. If we're talking about education, look at it. You understand? Not just like, oh, infrastructure in health as well. How are we adapting our country, our community, you understand me, to ensure that we are viable, you understand me, during this period as well.
Very, very important. As it stands, the issue is that governments seem to be having at this point is people taking responsibility for their health and safety as well. And I'm wondering what government can do in that aspect to win the confidence of a lot of people to ensuring they adhere to the measures put in place, non-pharmaceutical measures especially.
So, yes, so I think that one thing that the government can do is collaborate. I'm a fan of collaborations. There are several platforms. If I'm allowed to speak, safebody.com is also part of this platform, providing adequate information. This group of people have their audiences, they have their, you know, different group of people. So when government is able to collaborate and empower some of these platforms, giving several options to people, you understand that you don't really have to all the time have to be waiting online, you understand me, to get certain information. We've also empowered other platforms, other health platforms that are creating awareness, other non-health platforms as well, you understand. So I have partnership with things like Boat, Roku TV.
I can't mention that.
So okay, I can't mention, sorry, I'm so sorry. Partnering with other platforms that have large group of audiences, so that they could also spread the message as well, you understand. And so that each time someone is picking up the phone or picking up something, picking up a flyer or at a store, they are able to get that adequate information as well.
All right. Thank you so much, Dr. Azizat Yishao, Senior Health Advisor, Lagos Health Summit, and founder, SafeBody.com. Thank you for speaking with us.